Good afternoon, everyone. My name is Julie Akeroyd, and as a public member of the British Columbia College of Oral Health Professionals Board, it is my privilege to begin today's annual meeting with a territorial acknowledgement. The BCCOHP offices are located on the traditional, ancestral, and unceded territories of several distinct Coast Salish First Nations. The Vancouver office is on the territories of the Musqueam, Squamish, and Tsleil-Waututh nations, and the Victoria office sits on the territories of the Lekwungen peoples, specifically the Songhees and Esquimalt nations. I'm joining today from Victoria, and I'm grateful to live and work on these lands. In particular, I'm grateful to be raising my children at a time where they are learning about the principles of truth and reconciliation at a much earlier age than I did. And it is meaningful for me to be learning along with and oftentimes from them. I'm so appreciative to the many teachers and knowledge keepers who have helped me learn and unlearn as I continue on this journey. There are participants joining us from various parts of the province today. I thank you for making the time to be with us, and I invite you to take a moment to reflect on the traditional territories from which you are joining. On behalf of BCCOHP, I want to express our deep respect to these nations and their ongoing relationships with the lands and waters where we live and work. I will now invite Jen Smith, Indigenous Cultural Safety Educator of the Clowitsis Nation, to open our meeting.
Thank you so much, Julie. Gila Kesla, Gila Kestakwala. Thank you for inviting me to be a part of this important work here with you all today. As we move forward, I just wanted to provide some grounding for us as we gather for the BCCOHP annual general meeting. I would like to take a moment just to reflect a little bit on the purpose of today, reflecting to learn and to move forward in a good way. And having had the privilege myself of being a small part of the college's cultural safety journey, I have definitely witnessed the college's dedication, the individuals that make up this college, the shared commitments to cultural safety and humility, and to truth and reconciliation. And that was in just like a one-day training. So it was a big honor to be a part of that work with all of you. And I can see that these values are reflected in your ongoing goal of ensuring that care is safe for all people. So as you reflect today and we hear about, the work through your duties of doing the AGM, and look ahead, I know that you will continue to be intentional about that work, about how you move forward as you carry that responsibility to act with that deep respect. And Julie, I love that so much. Inclusion and awareness, and just that every single step that you take as a regulator contributes to cultural safety and equitable care. So with that, again, thank you so much for having me here today, and Gila Kesla.
Hi, everyone. Good evening. And I would also like to welcome you to the BC College of Oral Health Professionals annual meeting. My name is Melissa Mungal, and I'm the Manager of Engagement and Change Management here at BCCOHP. And I'm going to be your host for this meeting. So first off, thank you so much to Julie and Jen for grounding us in our commitments to cultural sensitivity and safe care. The theme of today's meeting is turning insight into action. This meeting is going to reflect on a year that's been marked by acceleration and momentum as we advanced our work to build a modern and responsive regulator. So I have a few housekeeping notes before we review our agenda and get to the rest of the meeting, of course. So please note the following. First off, microphones are muted and cameras are off for attendees. We are anticipating that this meeting will run for about an hour today. There will be an opportunity to ask questions during the question period using the Q&A panel, which will come up a little bit later on. And last but not least, if you experience any technical difficulties during the meeting, please email communications@oralhealthbc.ca and just flag your message as urgent. Okay, so I'll start by providing an overview of the agenda. First, we're going to have all of our speakers briefly introduce themselves. We're then going to be conducting a quick poll to see who's here with us today. Great. This will be followed by an address from board member Julie Ackroyd. We're then going to be welcoming Jeff Wellwood, audit partner at KPMG, to report on the audited financials. After that, we'll have a report from BCCOHP CEO and registrar, Chris Hacker. Next, we've set aside some time for questions during that question period. And finally, we'll share some closing remarks and conduct a short closing poll. So I'd now like to invite all of our speakers to briefly introduce themselves, beginning with Jen Smith.
Many thanks, Gela Kesla, Gela Dakwala, Gela Kesla, Katesi, Nukwa Tlatlak Gayu Tlaslak Kalaguis, Gayu Tlaslak Mimkumlis, Ola Gala Ikyok Nala, Gela Kesla. Hello, everybody. Roughly translated, I have said hello and welcome, and I've given thanks to the traditional territory where I sit today, and that's in my home, and that's located on beautiful Katesi territory, and that's in Pitt Meadows. I've told you that I come originally from Vancouver Island. I'm an island girl from two small little communities, Village Island and Turner Island. This is my nation, Turner Island, before we were displaced in the 50s. This is probably what it looked like around that time. Today is a great day. Thank you and welcome. I just want to touch briefly and hands up to you for just pausing for introductions. I just want to just explain briefly why are introductions important. And doing this work in cultural safety and humility and truth and reconciliation, we've learned together with an organization that I work with closely that introductions are how we are in relationship with each other, right? So we're more than just the work that we show up to do every day. We're humans first. So it is very important, especially in First Nations culture. Introductions are very, very important. It's how we know who you are and where you come from. So thank you so much again for pausing and doing things a little bit differently. Gila Kesla.
Thank you so much, Jen. And now I'm going to invite Julie to introduce herself.
Great. Thank you so much, Jen, for that. As I had said before, my name is Julie Ackroyd. I grew up on the traditional territory of the Comox First Nation in the Comox Valley, and I carry with me a deep respect for those lands and how they shaped me. I now live in Victoria on the ancestral lands of the Saanich, Tsleil-Waututh, and Lekwungen speaking people, and I share my life there with my husband and my 3 daughters.
Awesome. Thank you so much, Julie. And now I'm going to invite Jeff on to introduce himself.
Hi, everyone. My name is Jeff Wellwood, and I'm the KPMG audit partner who was responsible for the audit this year. I'm joining you today from North Vancouver, my home office, traditional territory of the Tsleil-Waututh Nation. I'm surrounded by forests, the mountains, and of course the inlet, and I am very thankful for time I get to spend with my wife and 2 children enjoying all of those areas. Back to you.
Thank you very much, Jeff. And now I'd like to introduce Chris.
Melissa, thanks so much. Hi, everyone. I'm thrilled to be here. And I think just to start personally, I'm the son of Jeff and Jean Hacker, who are 2 uninvited white settlers who arrived in Canada many years ago from the United Kingdom and settled immediately on the ancestral unceded territories of the Coast Salish people, represented by the Musqueam, Squamish, and Tsleil-Waututh. And I was raised in an area called Kerrisdale in Vancouver, Vancouver, and had the privilege of going to school and sharing my formative years with many members of the Musqueam, and was forever better for it. It taught me a lot about the inequities and the difficulty in growing up as an Indigenous person, especially in the 1960s and 1970s. But I was blown away by the engagement, the spirit of friendships that developed, the involvement in school sports and other activities, of course, that dominated our time there. And I think more than anything, the sense of humor and much of my own sense of humor, I think, comes from those early formative years. So I'm forever indebted. I'm also more broadly the Registrar CEO of BCCOHP, whose offices sit not only on the traditional unceded territory of the Coast Salish, but also the Lekwungen people of Vancouver Island. So just thrilled that you're here, and privileged to be working and playing and living in these incredible lands.
Thank you so much, Chris. And now I'll introduce myself. My name is Melissa Mungal. I work for BCCOHP in the area of change management and engagement. I'm excited to have you all with us today. I'm a second generation settler, an invited settler of European descent. And much like Chris, I'm joining from BCCOHP's Vancouver office. I live on Coquitlam territory, very close to the Coquitlam watershed. So I'm very lucky and grateful to be on and benefiting from the land there. And so really looking forward to having you with us here tonight, and looking forward to what the meeting has in store for us. So thank you. And thank you to everyone for sharing a little bit about yourselves. So we'll get started with our opening poll now. Attendees, you should see a poll pop up on your screen shortly. The questions are going to ask a bit about who you are. This will give us a good sense of who's in the virtual room. Okay, so the poll has just closed. Thank you so much to everyone for participating. The options to select in the poll were member of the public, certified dental assistant, dental hygienist, dental technician, dental therapist, dentist, denturist, other regulated health professional, media representative, and BCCOHP board, committee, or staff member. And so we have over 140 participants at the meeting currently, and it looks like we have a percentage breakdown. So I'll just give you an idea of who's in the room here. So we have about 8% public members. We have 11% CDAs, 31% dental hygienists, 5% dental technicians, dentists 19%, denturists 7%, and other regulated professionals 1%, and then board, committee, and staff members at 17%, and dental therapists 0%. So thank you so much to everyone who's joined today. And now I'm going to hand things back over to Julie Ackroyd. Julie's going to be providing some remarks on behalf of BCCOHP's board. So over to you, Julie.
Thanks very much, Melissa. On behalf of the board, I'm pleased to welcome you to the 2025 annual meeting of the BC College of Oral Health Professionals. To each one of you joining us today, thank you for making this time to be here as we reflect on the progress and achievements of the past year while looking ahead to the opportunities and challenges that await. As I mentioned, I'm a public member on BCCOHP's 12-member board, and I've been proud to serve in that role since the creation of the BCCOHP through amalgamation in 2022. Today, I am standing in for our board chair, Carl Roy, who could not be here and sends his regrets. The board is responsible for ensuring that BCCOHP's mandate, regulation of oral health care in the public interest, is carried out effectively and efficiently on behalf of British Columbians. So, what does that look like? The board provides oversight as BCCOHP regulates more than 16,000 oral health professionals across the province, including certified dental assistants, dental hygienists, dental technicians, dental therapists, dentists, and denturists. The board also sets strategic direction that informs BCCOHP's efforts to modernize professional regulation for the oral health team. Over my time on the board, I've experienced that each of us brings a commitment to transparent oversight and to ensure that BCCOHP is well positioned to serve the public despite our diverse backgrounds. This year's annual meeting is a meaningful one. It marks our final gathering under the current legislation and the last time we will be reporting out in this format. It is an interesting and eventful time in the realm of health regulation. As many of you know, with the Health Professions and Occupations Act, or HPOA as it's referred to, coming into force on April 1st, 2026, a government-appointed board will take effect. While the structure of that board is established under the HPOA itself, the individuals who will serve have not yet been appointed by the government. Despite any uncertainty around who will be at the table, I trust that the board, whatever its form, will remain a group of individuals committed to public protection. In light of this, I do want to take a moment today to acknowledge the contributions of my colleagues on the board and all of the thoughtful work that has been done to prepare for this change. We're looking ahead with confidence in BCCOHP's ongoing role in protecting the public and advancing safe, competent oral health care in BC. The transition to the HPOA will bring changes to BCCOHP as a regulator, but there are things that will remain constant. Our mission to protect the public and the professionalism and expertise of the BCCOHP staff team, who will ensure continuity throughout this transition and beyond. I'm just going to go over some highlights of our strategic achievements. So with a new strategic plan in hand at the start of the 2024-2025 fiscal year, we laid out 4 areas of strategic focus, including regulatory leadership, cultural safety and humility, health equity and anti-discrimination, and modernized regulatory functions. From a board perspective, we're very pleased to see our strategic plan in action with meaningful progress across all 4 areas. This past year, many carefully planned initiatives began to accelerate. The work to continue removing barriers and untangle complexity inherited from the amalgamation of 4 legacy regulators takes time. Bringing multiple systems, cultures, and approaches into alignment is no small task and has been a priority since amalgamation in 2022. Chris will be speaking to some of the more operational details around the progress made in each of the 4 areas of focus this year, so I would like to center my own remarks on a few highlights. As I mentioned before, BCCOHP is focused on preparing for the transition to the Health Professions and Occupations Act. This has included collaboration with health regulatory colleagues in BC who are also preparing for this legislation, as well as striking an internal steering committee comprising select members of the BCCOHP board and staff team. The HPOA Readiness Steering Committee provides oversight for the transition to the new Act and has set direction for the development of new bylaws. The HPOA will bring changes to health regulation at a systemic level, and there is plenty that regulators must do to be compliant. That said, many of the processes and operational interactions that oral health professionals and the public have with BCCOHP will remain unchanged. BCCOHP will be ready when the Act comes fully into force in 2026. In alignment with our commitment to cultural safety and humility, health equity, and anti-discrimination, the board recognizes the importance of embedding Indigenous ways of knowing into the organization. I've seen the organization's commitment to cultural safety and humility take root at the board level this year. With guidance from BCCOHP's Director of Cultural Safety and Humility, we began to embed new practices at the board level, such as the introduction circle that we had earlier in this meeting. In doing this, we are creating space and precedent for it to flow across all of BCCOHP's regulatory functions. Guided by this priority, staff have begun adapting regulatory processes and creating meaningful spaces for cultural learning and reflection. This is important groundwork, and we look forward to watching it take root. And finally, I'd be remiss if I didn't take this opportunity to celebrate the major milestone in June 2025 with the publication of the Unified Professional Standards for the Oral Health Team. These modernized standards mark a significant step forward as they bring together existing professional expectations into a single unified framework. They truly embody our commitment to modernizing our regulatory functions. In addition to this more visible milestone, the team at BCCOHP has been working tirelessly to continue the modernization of many other regulatory programs and processes. For example, the Consolidated Public Register and online portal, and the work that is ongoing to develop a modernized quality assurance program. I hope this overview paints a picture for you of our priorities and some of the processes we have made over the last year. Much more detail is available both on the BCCOHP website and in the annual report. In closing, I want to express my gratitude to my fellow board members, as well as all of BCCOHP's committee members for their expertise and commitment, and also to the staff team for their dedication and expertise. Additionally, we deeply value the contributions of oral health professionals and the public, whose engagement strengthens our work. Thank you.
Thank you so much, Julie, for those sentiments on behalf of the board. I'd like to now welcome our auditor with KPMG, Jeff Wellwood, who is going to report on the BCCOHP audited financials for the fiscal year 2024-25.
Thanks, Melissa. I'd like to briefly walk you through our audit report, as well as just a summary of the roles and responsibilities that support the integrity of the college's financial reporting. So as your independent auditors, KPMG's responsibility is to express an opinion on the annual financial statements in accordance with accounting standards for not-for-profit organizations. I'm pleased to confirm that we have obtained reasonable assurance that those financial statements for the year ended March 31st, 2025 are fairly presented in all material respects. We do believe they reflect the organization's financial activities accurately and transparently. This was our first year as auditors of the college, and as a result, we did include another matter disclosure in our audit report to highlight the fact that in 2024, there was a different auditor signing off on the financial statements. It's important to recognize the role of management in this process. Management's responsible for preparing the financial statements and for maintaining sound and internal controls and financial systems. The board of directors also plays a critical oversight role in this process by reviewing and approving the financial statements and ensuring that management is fulfilling its responsibilities. They also engage with us to understand our findings and recommendations. So finally, I would just like to pass along our appreciation to both the management and the board for all their cooperation this year in getting through a successful audit. Thanks, and back to you, Melissa.
Thank you so much for taking the time to be with us today, Jeff, and for providing us with that look at the last fiscal year. I'm now going to invite BCCOHP's Registrar and CEO, Chris Hacker, to say a few words.
Thanks so much, Melissa. Hi, everybody. Thanks so much for joining us for the annual meeting of the BC College of Oral Health Professionals. I'll introduce myself again really briefly in case anyone has just joined us a little later since the initial introductions. I'm Chris Hacker. I'm the Registrar and CEO of BCCOHP, and I'm pleased to be here today to build on the insights that Julie shared in her board report. To those joining us live and also to anyone watching the recording later, I recognize that taking time at the end of a busy day or out of a busy life is always difficult. Thank you so much for your engagement and spending time I know you don't have in being interested in the college's report. We're standing at a moment of both reflection and anticipation. The past year has given us real momentum, and the changes ahead are giving us the opportunity to carry that momentum into a new era of regulation. This past year has been one of growth as we continue turning insight into action at BCCOHP. But before I move into sharing more about our incentives and our initiatives and successes, I wanted to first share some thoughts about the bigger picture of the upcoming legislative transition. Sorry, unless I've got an unmute sign sitting in front of me. There we go. We've been waiting for clarity from the ministry for some time now on the time frame regarding enactment of the HPA or HPOA or the Health Professions and Occupations Act. And we now know that on April 1st, 2026, the new act will come into force. We're not saying goodbye to the old legislation just yet. That moment will come in April. But we did want to acknowledge that we've been preparing for closing of this chapter, and more importantly, we're looking forward. While this is a significant legislative transition, the Health Professions Act has been in place since the 1990s, and we're looking forward to updated legislation that better reflects our current context. We've been preparing for some time now as information has been rolling out from the Ministry of Health. This isn't about the end of something so much as the beginning of what comes next. The way I see it is that the new legislation gives us permission to continue the modernization work that we have already been started. As we walk the path to prepare for HPOA, it has become clear that in so many ways it aligns with the path we are already on. We see it as an opportunity to continue our work with even greater clarity and focus. While the legislation is changing, I also wanted to be clear that the obligations, responsibilities, and protections of public interest regulation will continue under the HPOA. What changes is the legislative framework under which we regulate. It affects how we relate to oral health professionals, how bylaws are made, oversight and committee structures. But it does not change the core of what oral health professionals do in their practice and how the public is protected. There is no expected disruption to the day-to-day practice of oral health. We're committed to communicating as clearly as possible as we walk this path together. Normally at our annual meeting, we focus on reporting out on the past fiscal year, which for us ended this past April. That's important work, and you'll still find those details in our annual report, as Julia's mentioned. But since this is our first annual meeting under the current legislation, our final annual meeting under the current legislation, I'd like to take a slightly different approach, if that's okay. Our sincere hope is always that by the end of this meeting, you'll have a better sense of who BCCOHP is as a regulator. So rather than looking narrowly at fiscal and operational information focused on 2024 or 25, I want to step back and give a broader update that covers where we are today in a longer arc of work. Right now, we're at about the halfway point of our 3-year strategic plan, which will guide us through 2027. That plan spans the legislative transition that we've been talking about, and it provides the continuity and direction we need to carry our mission forward, no matter what changes around us. So instead of treating this moment as the end of something, as I've mentioned, I'd like to use it to reflect on the progress we've made so far on the strategic plan. Julie had mentioned 4 strategic focuses, and I'd like to take a look at that strategic focus number 1, if I could, which is regulatory leadership. And really that focus is to identify strategic opportunities within regulatory modernization, including seamless transition. The board directive initiatives that flow from that strategic focus are to prepare for and implement the principles and requirements of the Health Professions and Occupations Act to better protect the public and facilitate good governance. It is to collaborate and engage with the public and other healthcare system partners to strengthen the delivery of safe, competent, and ethical healthcare by the professions we regulate. And the final initiative is to implement a risk-based and data-led approach to regulatory decision-making and measurement of performance outcomes. And I'm happy to go over some of the work completed against this initiative so far. BCCOHP has collaborated with various all-college HPOA working groups to establish a shared approach and a common approach to bylaw writing and enforcement under the Act. We've created HPOA Day 1 Readiness Project that contemplates oversight through a subcommittee of the board. We have shared our experience as a regulatory leader with provincial and national regulatory groups. We've created an organizational risk register. I'm happy to report that almost 90% of the bylaws are now drafted that are currently out for consultation, will be continued to be consulted with not only oral health professionals, but the public in general. We've drafted a change management plan to take us through to day one of HPOA. We've communicated with various audiences, and that is just the beginning. We hope to communicate much, much more. We've also created an anti-discrimination, equity, and reconciliation project, which will set the foundation for the organization to work to the HPOA's guiding principles. The second strategic focus, as Julie mentioned, is cultural safety and humility. And really it is to uphold Indigenous rights and promote reconciliation through the regulation and delivery of oral health care. The board-directed initiatives are to embed cultural safety and humility and Indigenous-specific anti-racism in all aspects of governance and operations, and eliminate barriers to Indigenous people accessing BCCOHP services. To set expectations for oral health professionals that support the delivery of culturally safe and humble oral health care. And finally, to ensure shared decision-making with Indigenous peoples, including the recruitment and retention of Indigenous board, committee, and staff members. The work completed to date includes the hiring of a director of cultural safety and humility. And I'm so pleased to welcome Katie Carson to our staff team. We've appointed an Indigenous consultation circle that works within the organization to help us in all matters of internal and external policy development. On April 25th, a workshop was held for the complaints team and inquiry committee that was led by Indigenous leaders and Katie as well. We've done work and completed work on an Indigenous poster and toolkit that we hope will help increase awareness of not only the work that we do, but how Indigenous people can more safely access those services. We've also launched an anti-discrimination, equity, and reconciliation webpage that I hope you'll find time to look for on our website. And finally, we finalized an Indigenous consultation school toolkit that will allow us to continue to consult with Indigenous leaders across the province as we continue to develop and refine our policy and process after day one. Strategic focus number 3 is health equity and anti-discrimination. And its aim is to prevent harm and discrimination, to create equity in oral health care experience, delivery, and outcomes. Board directive initiatives include building a safe and inclusive organizational culture that upholds anti-racism and anti-discrimination principles and measures. Identify and remove policies and practices that perpetuate discrimination. Implement regulatory processes that foster meaningful and respectful communication between oral health professionals, patients, and the public. And finally, to support oral health professionals to take action on health equity and discrimination. And some of the work completed to date includes an oral health equity dashboard launch, and I'd encourage you, if you can find it on the website, to take a look at it. And it really deals with an understanding of the many publics of BC that we represent, not just a single entity. Ensured across collaboration between strategic projects and using subject matter experts to embed anti-discrimination, equity, and a reconciliation lens into the development of new professional standards, the QA program, and HPOA preparation. Finalized discrimination risk matrix for complaints. And then finally, strategic focus number 4, modernized regulatory functions. To unify core regulatory functions and establish patient-centered standards that prioritize patient safety and promote the public interest. Initiatives here include implementing a single registration system and public register, establishing a quality assurance program for all oral health professionals, developing ethical principles, professional and practice standards for all oral health professionals. In the work completed to date, we've migrated the 4 legacy databases successfully into one database now. We've launched a new public register that streamlines the search process. Work continues on the development of the proposed quality assurance program framework consultation on the proposed quality assurance framework that you will have hopefully been able to participate in. The findings from that consultation are now being turned into active work on designing the final program that will go to the board for approval. And we've consulted with the public and BC Public Advisory Network for the creation of professional standards after having drafted those new standards for the oral health team. Board approval for those final professional standards has happened and they've become enacted. They were launched with supportive resources, including videos for oral health professionals and the public posted to the website. And multilingual standards have been published in 5 most spoken languages in BC to help members of the public understand the importance and outcomes in their favor from those standards. Thanks, Danielle, that's great. You've heard us mention a few times that this will be our last annual meeting conducted under the current Health Professions Act. In closing, I want to emphasize that this is not a sign that we are stepping away from transparency or connection. Far from it. BCCOHP will continue to provide regular updates about our initiatives through our website, email news, consultations, events, and other engagement activities. These are tools that reflect the role of a modern regulator, and the new legislation gives us the opportunity to leave behind this outdated requirement of an annual general meeting and instead focus on more modern, meaningful ways of engaging. And on that note, I'm excited to share that we'll be making BCCOHP's debut at the Pacific Dental Conference next March to make the most of a chance to connect in person with a wide cross-section of oral health professionals. So in closing, I want to express gratitude to all of you as oral health professionals for your partnership and feedback, to the board and committee members for your insights and dedication, to our staff who work hard every day to build and implement these systems. Finally, to the public and other health systems partners for trusting us and for engaging with us. The coming year promises to be full of beginnings. As we close out the era of the HPA and enter that of the HPOA, you can rest assured that BCCOHP will meet the challenge, continuing to protect the public, support oral health professionals in safe practice, and build a strong, transparent regulator. Thanks so much for being here and for listening. And Melissa, I'll pass it back to you.
Thank you so much, Chris. We're now going to be moving into question period. So for anyone who has a question, I ask that you please use the Q&A function on your screen to submit your question. Just note that we are going to try to prioritize questions that are most relevant to the broadest audience, and that includes the public. And we may not answer questions if they're really specific or if they refer to private or personal information, of course. So I'll start us off with one because we did receive one shortly ago, Chris, and that is regarding amalgamation and alignment of Legacy College and then the transition to legislation. So someone said, I know there's lots of changes with the amalgamation and alignment of the Legacy Colleges and the work that needs to be completed to ensure the adherence to the HPOA or to the HPA and the HPOA legislations. The question that I have is regarding the amalgamation and changes. Would all registrants be considered self-regulating? Or is there a new terminology or approach to regulation since we are not one profession regulating ourselves or one profession regulating another profession?
Wow, Melissa, what a great question, huh? To begin, I think naming regulation has always been difficult, and I think organized regulation, certainly in North America, began in the late 1800s, has continued on in its various iterations over that time. And in those early days, it was very much self-regulation. The professions were in control of how their members, as they saw them, were overseen and how best practices were continued and supported. It was really about trying to balance the increasing power differential between practitioners who had knowledge and members of the public who became patients and didn't. But I think as the 1900s went on, it was recognized more and more that the public needed to be involved in oversight of those professions as well. The suspicions that professions were working in their own interest, and determinations and findings were always in the favor of the membership rather than the public. So we moved through a period of what might have been called co-regulation, and this was kind of I think probably embedded in legislation in the early 1990s when the HPA first came to British Columbia, and public membership on boards was mandated at that point. As refinement of regulation has continued, as amending has continued, as reports like the Caton report and the In Plain Sight report started to impact the development and the design of the new legislation, I think it's probably fair to say that we're really in a period of professional regulation, as we would call it, where there is shared oversight between the public and the profession in terms of sitting in governance of the organization. Still understanding, though, that our obligation to work in the public interest, to work for the public, flows from the organization through the board into the ministry and to the people of British Columbia. So I think it's safe to say that with the HPOA coming soon and the understanding that boards will now be fully appointed, I think we can probably safely say that we are no longer in a period of self-regulation. But ironically, I think self-regulation has never been more important. And what I mean by that is every one of our regulated oral health professionals we oversee self-regulates every day. We as the regulator are not in the room when care is being provided. And we could not, as an organization, protect the public without the safe practice that so many of our oral health professionals provide. I think we've understood that, again, if our role in public protection is really to help support our professionals in making safe choices and understanding the expectations and defining what safe care looks like. And we've done that through, I hope are clearly stated expectations of professional performance that will kind of run through into practice standards where risk to patients is high. But I think it also underpins our approach to regulation, which is a little bit different than it has been. We've come through a period probably over the last 100 years where regulation has been very much rules based, very specific, granular expectations around clinical care. And I think where we're trying to go with this is by pulling back into a more principles-based approach, providing guardrails to care rather than railway tracks. We want to try to give latitude to the professional expertise of every one of our registrants to provide care in the context of the patient, rather than dictating specific granular aspects of care that may or may not be applicable or suitable in that specific space. So I hope that maybe answers the question. I'm not sure if you have another follow-up on that, if it's not completely answered.
No, I don't have a follow-up to that one, but I do have another question, Chris. We've received a few questions regarding the regulation of dental assistants under the new HPOA or the new Act. I'm just wondering if you're able to speak a little bit to that.
The regulation of certified dental assistants.
Yes, thank you.
Yeah, no, that's fine. Gosh, I know probably a lot of you have written questions and thoughts and concerns to us over the last couple of months, certainly upon the release of the regulations that the ministry has put out that will be supported and underpinned by the new legislation. I think we really can't say much because so much is out of our control as to what enactment of the new legislation is going to look like. But I think what I can say is BCCOHP is continuing to explore options to establish further bylaws that will enable regulation of dental assistants beyond April 1st, 2026. Section 539 of the Health Professions and Occupations Act, which is called Bill 36 at this point, provides a provision to continue to regulate certified non-registrants. So I think we'll continue to share updates with all the oral health professionals we regulate as more information becomes available. In the meantime, you can follow the latest details on our Health Professions and Occupations Act webpage. And I understand, Melissa, it's probably an unsatisfactory answer, but again, I think we are continuing to explore all of the options to continue regulating.
Thank you for speaking to what you can there, Chris. Okay, we do have a couple of questions that have come in regarding the proposed QA program framework. And so I'm wondering if you're able to give a little bit of detail around the status of that and anything else that you're able to share broadly on it.
Yeah, that's in terms of where we were trying to go with quality assurance and understanding that the new act really is designed to hopefully be supportive of some of the modernized changes we realize we're making. And I think one of the epiphanies that we've come to over our ongoing evolving and understanding of our role as a regulator as BCCOHP, and this work began, as Julie mentioned, in September of 2022 as we became a new regulator. We've realized that modernization is really about role clarity and trying to distill the essence of what it is we do as we are more profession-centric organizations, sort of over those last 50 years, 100 years, our roles were pulled and expanded beyond what our legislative authority was. And really, at the end of the day, we work within the health system of British Columbia, as all regulators do within their own jurisdictional health systems. And health systems broadly are about improving health outcomes for the people that live in the province, in our case, British Columbia. We, in our tiny bucket of authority, really are responsible for contributing to improved health outcomes by simply ensuring that the person showing up to provide the oral health care is competent. And so we've realized that what we are is just an integrated set of competency measurements. We measure competence to allow successful licensees into the practice, and we measure ongoing competence through our QA program. And I think historically, and especially given old legislative mandates, those quality assurance programs were really involved in quantitative assessments of continuing professional development and continuous practice. And those two measurements together were determined to have assured that the person continuing to practice is competent. We've recognized through a lot of research that those numbers really are not related and not relevant to measuring anybody's competence. And so we determined that we would take a different approach to quality assurance, understanding that professional development is a professional obligation, and hoping that all of our registrants will continue to pursue professional development in the areas that interest them and the areas that are relevant to their practice. What our obligation to the public is to ensure that each regulated member of the oral healthcare team is competent in the moment. And so what we have done is we have determined to define competent care through our professional standards and flowing into those practice standards, again, where risk is high, and having those standards define that level of competence. And what we're hoping to do is set up an ongoing quality assurance program that allows our individual registrants to measure their own performance against that definition of competent care, and any gaps that might be identified, we can help support confidentially in mitigating that gap and in directing education in those areas where the performance of the individual may be less than what we're hoping for. So it really becomes an assessment of performance rather than an assessment of professional development. So to that end, we've consulted on the framework, and we wanted to get this out early to our registrants to try to get some feedback on where they saw problems, where they saw confusion, where they saw potential unintended consequences of it. That consultation feedback has now been assessed, and the internal and external staff teams, the subject matter experts that we have engaged in this work are now working on developing that final draft quality assurance program that will be then going to the board. So Julie and the board will have the final say in approving that quality assurance program or not, and hoping to initiate sometime in the new year.
Thanks so much for that, Chris. We are almost out of time. I do want to kind of squeeze in one, possibly a second question. Just a quick follow-up to the QA proposed QA program framework question. A few of the questions that we received were inquiries about the program cost, and just wondering if you might be able to speak a little bit to that.
Well, I think we probably need a program first. But I think, what I want to reassure is that none of these initiatives should come with any significant cost to them. We're doing most of the work internally, again, with the help of the consultations that we run and board membership. The committee that oversees this is doing hard work as well, but that budgeting has always been built into the work that was done. So I think at this point in time, it's just too early to tell what kind of costs might be associated with this. But please understand that there are ongoing costs to administering the existing quality assurance program through the staff costs that it takes to run that existing program. So we would expect that organizational cost will always be a part of regulation. This is regulatory output that we're doing. And again, understand that the board is very, very, very much aware of their fiduciary duty in keeping costs low. It probably should be noted that for the first 2 years of BCCOHP's existence, there were no increases in fees, and there was a small increase for this year. So I think we'll certainly be transparent about any costs going forward, but I don't imagine that they're going to be anything more than what has already been established.
Thanks so much for that, Chris. That's all the time that we have for questions. And so now I'd like to invite Jen Smith with us again to close our annual meeting. And thank you to everyone. Jen?
Yeah, like I said, everybody, thank you so much again for having me here with you all today. As we come to the close of today's meeting, I want to acknowledge the meaningful conversations and the thoughtful work that has taken place throughout this transition and the change, especially starting at the board level. I love to hear that. So hands up for that leadership piece. And just on a personal note, it gives me great hope as a First Nations person, as a person who lives in BC and a grandma of 5, soon to be 6 any day now, that this work is taking place. There is big changes coming for everybody in the regulator world. And I just want to acknowledge that change can be hard. Change can be scary. But just the last few closing words, turning insight into action requires courage. Courage to listen deeply, to reflect honestly, and to take steps that strengthen trust and safety for all providers. As we hear today, there's a lot of questions coming forward, but for everyone that you serve. So BCCOHP's ongoing commitment to public safety, to cultural safety and humility, and to truth and reconciliation is a reminder that progress isn't just about systems or policy. It's about people. It's about creating care environments where respect, inclusion, and safety are lived values and not just words. And that's really meaningful. So as you guys carry this work forward, I encourage you to continue to lead with intention, with humility, and with heart. With that, the people at the center there. And I look forward to witnessing the work that you will continue to carry out in a good way, embedded in Indigenous ways of knowing and being. Hands right up for that. And thank you again for inviting me to be a part of this important journey. And Gila Kisla, everybody. Thank you, thank you, thank you.
Thank you so much. Thank you so much, Jen. We've covered a lot of ground this evening. So I'd like to thank you all for joining this meeting and for being here this evening and taking the time out of your day to be with us. I'd also like to thank all of the speakers and the planning team who put in many, many hours to help plan content that's useful and informative. So a recording of this meeting is going to be posted on BCCOHP's website. Please stay if you can for a few moments after the close of the meeting, as we have a short exit poll, and we hope you're going to participate in that. And so this concludes the 2025 annual meeting. Thank you again, and we hope you have a great evening.